Welcome to episode number 151 of CXO Talk. I'm Michael Krigsman, and today we are speaking with Julia Hu, who is the CEO and the founder of Lark Technologies. Lark Technologies is aggregating a large amount of data that it puts into the service of an app to improve healthcare. And so we're going to be talking about data and healthcare today. Julia, how are you?
Great. Thanks so much, Dave. Great to be here.
You know, a lot of people call me Dave, even though my name is Michael, but that's okay.
Oh my God.
I've been getting that through my whole life. But anyways, so tell us about Lark Technologies.
I'm sorry, I've been sleep deprived. Michael.
I know you're
right.
traveling. Well, I know you've been traveling a lot. And you're in an office someplace across the country.
That's right. I am in our partner's boardroom right now. But thank you so much, Michael. Great. Yeah, great to be here.
So tell us about Lark Technologies. Tell us what you do.
Sure. So we really try to help people connect with someone who understands them and can really coach them toward better health and happiness. And so, Lark really started when I was a little kid. I didn't start Lark when I was a little kid, but the spirit of Lark really started when I was a little kid. And I grew up with these horrible stomach attacks. And it would happen every few weeks, and it went undiagnosed for about 20 years. And so I think I just survived my childhood and lived a great childhood by working with my pediatrician and my father, and they were like my coach team. They were with me 24/7 practically, giving me advice, but also cheering me on. And so that's who Lark is. We try to create a 24/7, personal health coach that's there by your side anytime and anywhere.
So when you say a personal health coach, what exactly do you mean?
Well, it's actually a text buddy, and it is a chat buddy that you can text anytime. Lark also texts with you, your Lark coach, and it looks at all of the information, health data about you, from your steps to what you ate to your sleep, and it looks at that, and then it coaches you at the right moments with tiny little conversations.
Well, I guess the obvious question then becomes, how does it know what to say to you and how to coach you? And how do you make it not just something that's superficial, but that's actually meaningful?
Yeah, absolutely. So, the whole thing around having a coach in your pocket, right, using your mobile phone, it's really opened up because of a couple of macro trends, and the first obvious trend is the mobile phone, and it has so many sensors now, health sensors, motion sensors. We can actually get information about that person without Joe telling you what he was doing. We can see that not only he took 10,000 steps, but really that 10,000 steps was a 30-minute bike ride, and then it was pacing around at the office. And so we really can get so much passive data from this so-called Internet of Things, from your Apple Watch, from your wireless scales. And all of these things are coming in to Lark, and Lark is basically looking at that and saying, okay, what should the coach say now? And so we have live coaches, and we have some of the best Harvard and Stanford faculty in health and behavior change on our coaching team. But really, what's extending that personal 24/7 experience to everyone is the advent of artificial intelligence technology.
So you're tracking, or the user is tracking through the sensors in their phone, but at the same time you are collecting data from experts as well and mixing the two types of data, this phone, basically the sensor data and the expert data. Is that correct?
Yeah, exactly. So it's experts are the ones who are interpreting the data and coaching you at the right times. Whereas the sensor data is really just coming in so that we can build a better understanding of who you are, what your goals are, and how you're doing at this exact moment.
So tell us how the expert data works. And I know that you employ data scientists and machine learning and artificial intelligence. And so maybe break that down for us. Describe to us how that pieces together.
Yeah, sure. So I think, one of the best examples, I think, is actually explaining, how we first started. We met this woman, Sherry Ma, and Dr. Ma is a great researcher at Stanford. She also happens to coach NBA stars and Olympians and NFL stars. And she would take these $5,000 sleep monitors, medical grade monitors, and she would put them on each of her athletes. And then at the end of the week, she would collect all the data, by hand and analyze it. And then she would start texting them and coaching them. And we thought that, wow, if everyone could have a Sherry Ma in their pocket, they'd be breaking world records like these, amazing athletes were. And so she helped them sleep better and then perform better. So we wanted to replicate that experience. And so really, if you think about that, it's in two categories. The first category is, of course, gathering that personal data. And the second category is really in the coaching. And so the way that we've kind of cloned Sherry, so to speak, is by understanding what she would say to all of her athletes in all different scenarios, and map that to to basically a system where we can then pull up every single Sherry conversation at any given time, depending on what the user and what the client or the user is doing. And so it was a lot of mapping of, let's get the data in somehow. So we actually built one of the first wearables in the wearable industry that was wireless. So we built a Bluetooth wearable, and we sold it in all Apple stores, and it was helping you monitor sleep. And then we took that data, we went a step further. We didn't just show the data to the user. We actually took that and ran that through our generation 1 artificial intelligence engine that really then said, oh, okay, this is what Sherry would say at this moment. If since you're traveling, this is what Sherry would say to get rid of jet lag. So it was really building on that. And now we're on our 4th generation AI engine.
So one of the things, so we have a question already from Twitter from Alan Berkson, and he's asking about the privacy and the liability aspects of this. And so maybe jump in and let's address some of his concerns about those two issues. And then let's come back and talk further about how do you get this expert data? How do you model it? When you talk about artificial intelligence, what exactly does that mean?
Yeah, sure. So let's talk about privacy first. Privacy is super important to us, and what we really believe is that every single person is controlling how much they share with us to the most granular level. So so basically, we're providing a service based on how much information you're willing to give us, and the way that we do that is we basically ask you permissions in the very beginning for everything, and what's great is if you're familiar with Apple Health Kit. Apple Health Kit is this wonderful, I think, wonderful example of where big data is going. The idea of an open data ecosystem, much like Google Fit, Samsung Health, this open data ecosystem where different devices, say your Apple Watch information or your wireless glucometer information or, any wearable information, right? All of this information or app information, data from Strava, all of this data can actually come into this one, holding ground, this warehouse. And then Apple created HealthKit, which allows and permissions, allows you to get every single access, permission other apps and other services to take data from this pool. And so a user can actually say, I want to give Lark my exercise data, but I don't want to give Lark my sleep data. And I don't want to give Lark my height and weight data. So it's really interesting. You can permission to the nth degree, and that allows for a true sense of privacy, that I own what I own and I give it to data, and of course Lark doesn't share it with third parties, and so we don't share personal level data to any third parties. So that's the that's how we see privacy, and I think it becomes increasingly important as more and more of this IoT health data becomes available.
So the sense of control, or the reality of control that the user has over their data, creates the sense of privacy, and therefore, I'm assuming by extension, also creates a sense of trust with the app and with Lark Technologies, your company that creates the app.
Yeah, absolutely. And in terms of liability, we help people, focus on a few areas. So we help people eat healthier, exercise in a more effective and hopefully more way. So we're encouraging them, sleep better. Stress. We work on stress, and overall, we do it in a very positive way through some of the gold standards of coaching and therapy. So CBT, cognitive behavioral therapy, has been very effective. So we do all of these things that are really around lifestyle management. We coach on different chronic diseases. So if you are pre-diabetic, or you are diabetic, we coach you in different ways. So we have a pretty wide chronic disease platform that focuses on different disease management areas, and also wellness management areas. And in terms of liability, what we don't do is we're not a medical device, so we'll never, for example, titrate your medicines, give you different dosages of medicines. What we do though is with our healthcare partners, we do escalate when we see a potentially worse trend. We can escalate to real nurses who actually can help you.
That's really interesting. So the app can go off the phone, so to speak, and connect with the user's real world health activities.
Yeah, that's right. So, so, we have we are a B2B2C company. And so on one hand, we have a B2C product, and the B2C product is out there. It's free, and it's, it's basically the Lark Coach if you want to get a little fitter, stay healthy, and it chats with you about certain things. We also use the same AI technology and coaching technology to provide deeper coaching services for people, who are like me, who basically are chronic disease patients, but we're also regular people. And so, it's just a casual conversation to kind of keep us on track, so to speak. And those healthcare, the healthcare programs, they're much more with our healthcare partners. So we work with health insurance companies, we work with pharma companies, and basically we help manage and prevent chronic diseases. And in those different programs, then the escalation to a healthcare provider or a nurse or a coach for telephonic help or live help is definitely an offering.
Okay, let's go back to this notion of artificial intelligence and machine learning and the data science behind your application. So
Yeah.
Would you elaborate on that?
Yeah, sure. So it's really interesting because in the past, the way that we have really approached healthcare is by understanding general demographic trends. So you might have heard people talk about population health. What is population health? It's this idea that each population, for example, Asian American women who have a background of this. Each population has different characteristics, and so when you want to coach them to get better, or you want to look at how to influence them, it's done by these demographics. But with IoT and with personalized data, it's kind of opening up a new area of, it's almost population health for the population of one, right? It's your data. And so for example, we found that our research shows that if you don't get a lot of sleep, that you are much more likely to be stressed, right? And so we can actually see that when you haven't slept for very well for 2-3 nights in a row, at 2 p.m. that's when you're most likely to be stressed the next day. And we'll say like, hey, how are you feeling? You might be a little stressed because you haven't slept well in these last few days. How are you feeling? And you can say, yeah, I do feel stressed. And we can say, well, that means that you'll probably be craving a lot more fatty foods right now. So think about getting some nuts instead. So it's if this person wants to lose weight, for example. So it's examples like that are that just kind of show the power of understanding a person more and more. If you just have the number of steps that you took, your coaching can't get much more complex than, hey, you hit 9,000 steps yesterday. Today, try to hit 10,000 steps. But we think that big data really is so much more. I'm kind of an extremist in the way that I view data. I'm not a technology geek, so I'm the non-technical co-founder of a tech company. And the way that I see it is, the more data there is, the more continuous data there is in healthcare and in many other things, the better we can get at predicting issues and predicting wants and desires, and for us, what we want is as much real-time data as possible, as many streams of it. But when we talk to you, we don't talk about the nitty-gritty data, because you as a person don't have time to deal with it. And so we really believe in ultra simplification of all of this data, and to turn it into a conversation. And so that's really the way that we think about it. We want to, we do tons of machine learning in the background of, what activity was that motion, and, based on the way you used your phone, how many minutes did you sleep at night? We use all of that machine learning to like figure out the patterns that you have. And then we simply just have a conversation with you, so that you don't have to type in, I started sleeping here. I started my run here. I ate 3 grams of white rice today. And it's basically done in a text message way, and mainly behind the scenes.
How do you model the expert advice that you get? How do you model the experts?
Yeah. It's, it really came in phases. So we've been working on this for 5 years now. At first, we modeled what I would consider the brains. So we basically looked at these incredible, research papers, and we looked at how our health experts intervened and coached their patients, their customers, their members, and we first looked at just transferring like methodologies. So it was very dry, and I would say, like, we would just say, okay, if person hasn't eaten for several hours, this is probably what they're craving. This is what they usually eat. Let's suggest these things. So we would do things that were very, by the book. So, we automated the American Dietary Guidelines, for example. And so, our experts would help us automate all of these guidelines, interventions that were all research-based. What we found was that when we just told them information and educated them about these rules, so to speak, it didn't actually change behavior that much. And so, as I was reaching into my childhood and understanding the parallels, basically what we did was we translated what the doctor was telling us, right? You need to eat less sugar, you need to eat more carbs, you need to sleep at least 8 hours. So we were translating the education, and that was important, but it doesn't help with engagement as much. It doesn't help with actual behavior change that much. And so then we started thinking about, okay, my father was my cheerleader. He was my, kind of stick and carrot. And my pediatrician was the one that, taught me to be more mindful and test things about myself. And so how do you actually systematically use artificial intelligence to mimic those very soft things, right? The idea of compassion, of love, of no judgment. How do you actually translate that? And so we started looking for people that were experts in systematically understanding that. So it goes beyond just psychology, and positive psychology. And that's where we looked into, the most effective types of therapy is CBT, cognitive behavioral therapy. It's about reframing your mind to think about the situation in a different way, in a more positive way. And that's a very, simplified version of it. We looked at, cognitive. We have a professor who is a neuroeconomist and studies how people make decisions. And we hired a person who was at the Stanford Research Lab in compassion and altruism. And so basically, we then used their research to start creating a personality that felt very personal to you. So Lark figures out how much of a sense of humor you have, and changes its tone a little bit to you. But basically, we systematically kind of brought in the science of behavior change of CBT into the tone and the warmth of the voice. And I think that's why when people talk to Lark, they say they don't call it a tool. They don't call it a monitor. They say things like she really understands me, and she's my buddy. She gives me little nudges, and that idea, I think, is really exciting. The idea that we can start to bring the best of coaches and nurses and doctors and extend it in a personalized way to people.
So you spoke with these apps.
I can't hear.
Oh, you can't hear now? How about now?
Oh, still not.
Okay. Well, don't you guys love...
Uh-oh.
Uh-oh. No dice?
We're having technical difficulties. Can you hear me?
I can hear you.
Okay, I can't hear you.
Okay, I have an idea. Hold on. Let's see here. I have, the way this works is I have a list of questions that, hang on.
Do you want to call me, or?
Hold on.
Oh, I can't see that either. Oh, okay. Okay. All right. What is the connection between data and healthcare? All right. So what's really exciting is that healthcare has always been a very data-driven industry. It's just that the data has always been, frankly, very, very, sporadic, right? So you go to your doctor once a year to get your annual checkup. You get, a couple of markers there. You have all of these tests, and it's very sporadic. But health has been always a very data-centric industry. What I think is so exciting is that now, as you're able to fill in perhaps much less granular data, but data nonetheless about a person, you're able to kind of fill in those gaps. And what's exciting about that is that then, healthcare can really move from a very, very focused on, a Band-Aid solution to address those few points in your life. It can be a preventive, continuous improvement. And so, the healthcare doesn't have to be as drastic, right? You are preventing diabetes by reducing their BMI, their weight, and that can extend your life quality and your life by years. And so what we're seeing is this shift toward continuous healthcare at a more manageable daily kind of, daily wellness cycle. So I think that is an amazing transformation that's not possible if you don't have all of that data and your benchmarks. We look at everyone as a profile of themselves, and everyone has kind of a digital, signature. Their life has we're creatures of habit. We have a signature of how our life is. And sometimes it's higher, sometimes it's lower. And hopefully the graph should be a sustained, improvement. So I think healthcare is really improving in that way.
Can you hear me now?
Yep.
Oh, good. These things happen on the internet. It's a wild west out. It's a wild west out there on the internet.
That's right.
So we have a question from Esteban Kolsky, who is an industry analyst, and it's really relating to again what we were talking about. How do machines learn from experts? So can you again elaborate on how that happens? Right.
So. How do machines learn from experts? And right now, I really would not say that we are, an AI company. We really are kind of this, this nice combination of coaching and using AI to extend the power of coaching. So I think it's actually not just how can experts, data machines learn from experts. It's actually a feedback loop, a very, very, so what I think data and IoT and all that is we have incredibly, sped up the feedback loop in which we learn. So I'll give you an example. In the beginning, we started building, basically a set of systems that allowed us to very quickly figure out, which interventions actually work, which conversations do not actually encourage someone to do something. And so, there's a lot of research that says, if you give someone, a little bit of positive feedback right after they do something, then they'll internalize it as a great thing. And we can, we have hundreds of different types of conversations that tell it to you in different ways, in different tones. Some of it is a little more sarcastic. Some of it is a little bit, more warm. And so the idea of then, having these, thousands of A/B tests, because all of us are different, and seeing how the user reacts to those and seeing what they actually do after we tell them what to do, these systems of feedback can then be presented to our coaches. And our coaches can then help us make broad coaching changes. And so, our conversations are not written by a machine. They are written and they are actual real coaching conversations that are created by real human beings. But it's just that the feedback loop is so fast because, we ask a person what they ate for lunch. They tell us, that they had a lot of carbs and a little bit of vegetables, and then we tell them, we'll challenge you to eat more vegetables at dinner, and in a fun way, and then we can see if they did that at night. So it's really amazing because instead of clinical studies of a few hundred people in a very, very protected environment, in a very structured environment, we have real world studies of how people are acting. And we're making all of these tweaks to our engine constantly based on all of our conversations.
Arsalan Khan asks on Twitter so do you have your own homegrown, home-developed AI engine, and how long did it take you to develop?
Yeah, we do. we home grew it, and it's our baby is 5 years old now. So it's taken a long time, and I laugh. I talk to my co-founder and my team, and I laugh at how in the first 4 years our AI coaching felt like a 4-year-old at best. It was so clunky. It didn't really understand things. And I think at the fourth year we had a turning point, and the conversations felt more natural. Of course, we have so much more to go, but we used all of the different data pieces. So we have 70 devices that we hook into now. And most of the smartphones out there. So that's a couple thousand products that we also hook into, and we just coach on top of that. And now we're going to be pre-installed in all of the new Samsung phones as a chat buddy. So it's pretty exciting.
So let's talk about the business and entrepreneurial aspects. Since you mentioned you have a deal with Samsung to be on their new phones, and I know you have a relationship with Apple. And so how does a company such as yours develop these kinds of relationships? I think every entrepreneur wants to have these kinds of relationships with larger companies or such significant channel. How do you do it?
Well, I think what's really exciting is you just put a stake out there and you take some risks, and I think you just try to innovate. I think that's the best way, because these innovative companies are looking for innovative companies to support, and frankly, like that's how we started developing relationships with them. We had our products sold in all Apple stores globally, and that's how we started our relationship. But really, I would just say, it's a great time for startups, because as long as you're kind of pushing the envelope, there are so many corporate development folks in innovation that work on finding industry leaders in thought leadership. And so press obviously helps a lot. Forrester Research, a Wall Street analyst, named us the most innovative digital health product of the year, and published a large paper on us. And that, things like that certainly help, establish credibility, and get your name out there. But I think there's, it's a great time, because there's so many companies focused on innovation now.
What are some of the challenges that you have faced in building this business?
Oh my gosh, so many. So I would say that market timing is always so critical, and I think we are taking a huge leap. We walked away from a hardware software business, and just went straight to software. And we walked away from a couple $1 million in revenue, and the hardest part was really finding product market fit. And we knew that we wanted to really focus on personal coaching, and creating a personal health team. But AI takes a long time to build, and so we really had to sell the long dream. We had to get VC funding, and now that our our product is finally there, after years and years of R&D, finally good enough to be an extension of a nurse or a coach. Our chronic disease platform is finally, it's being used by health insurance companies to basically augment, and in many cases even drastically reduce the amount of the amount of expense in having a very large telephonic coaching center that doesn't know when to reach out to you is troublesome. So if you have all of these coaches and nurses not knowing when to reach out to you, not knowing and not being able to personally coach each and every person all the time, if we're basically being an extension of that huge industry, that's taken a long time. So I would absolutely say, as a startup, balancing R&D and cash flow, and to finding and sticking with your ultimate dream of where you think your company can go. And we felt personally that we could not be the best company we could be if we focused on both our hardware device and our software coaching services. So we took a big gamble in basically ripping part of our company out. So that's been a big challenge. Yeah, but I hope we see that things are paying off.
We have just a few minutes left. And so maybe you can share your advice for other entrepreneurs. What did you learn during this product market fit, developing your value proposition and making the difficult decision to abandon a multi-million-dollar segment of your business in favor of what you're doing now? So just in our last few minutes, maybe share your advice from your experience going through that process.
Yeah, well, I think that what I would say is, really dream big. No matter how big or small your vision is, it's going to take a lot of years. It's going to take a lot of sweat, and so you might as well dream big, because if you don't hit the stars, maybe you'll hit the moon, right? It's great to have something that drives you, but also drives people to follow you. And so I really learned that, in the beginning, I was much more timid, and my dream was actually to be in SkyMall. I wanted to be in SkyMall, and I wanted my device to be there, and we just I didn't realize that I could dream so much bigger, and I think taking a few steps in that direction, I just remember one of my mentors saying, hey, like if you don't want to go big, then just go home. And then I started being able to believe that my idealism and my hope that everyone in the world who needed it could have, a 24/7 personal health team, someone that could be there, that cared for them, that understood and didn't judge them, that helped them get better, and help themselves get, learn the tools to empower themselves. I think that dream was always, part of me growing up. And I think it was just to allow myself to believe that we could change the world if we focused on that vision. I think, I think entrepreneurship is about dreams, and and being able to kind of believe in that and not get too jaded, I think is really important. And I think the other thing is, you know, you're obviously not gonna hit that dream on the first day, and that's okay. And that failing really quickly and learning from these failures is totally part of the process. And you know, I think that being forgiving of yourself when you do fail is really, really critical, because you're going to fail every day. I fail all the time, you know, and I feel like I've become more resilient to the failure, and I don't let it hold me back. And I sometimes use it to fuel me, you know, you know, so
Okay.
it's, yeah.
Yeah. So having the confidence to push forward, and at the same time being resilient when things are not going your way, fundamentally is the bottom line.
Yeah. Yeah.
Okay. Well, we have been talking with Julia Hu is the co-founder and CEO of Lark Technologies, and this has been episode number 151 of CXO Talk. Julia, thank you so much for taking the time today.
Thank you so much, Michael. Or should I call you Dave?
Yeah, call me Dave. And everybody, thank you so much for watching, and we will see you next time. Bye-bye.
Bye.